The main thing about this presentation is that it's the long-term follow-up. This is a study that's been going on for now, 5 years. So it is important to see what happens with the long-term exposure since patients are on therapy for a long period of time. So that's essentially what we're focusing on, what happens with this long-term follow-up. These adverse events are of interest because they're somewhat unique. So first, GI, we see that really the GI happens mostly early. We didn't see much happening late. If anything, what we see is that the GI toxicity improves or disappears over time. Really, very rarely, patients need to be taken off therapy because of GI toxicity. So that is very manageable. Pleural effusion, we do see it with Bosutinib, like we see it with most TKIs, but the incidence is low. Even with the 5 years of follow-up, it only reaches about 6%. We do see new events happening late, so it is something that the physicians and the patients have to be aware of. But again, it is very rare, and it's usually grade 1 or grade 2. Having to take a patient off because of pleural effusion is very rare. And from this rate, it certainly doesn't reach the levels that we see with other tyrosine kinase inhibitors. So it is something very manageable, but again, something to be aware of. Renal toxicity, the first thing is that it's not really a toxicity, meaning it doesn't cause renal damage. We do see a decrease in glomerular filtration rate. It seems to be an issue of reabsorption of the creatinine. But it is important to monitor the patients because, again, it is something that happens a little over time. The incidence is low, and it's usually mild. Again, it is very rare, if ever, that you need to take a patient off therapy because of these renal issues, but certainly something that deserves attention and monitoring of the patients, particularly in terms of trying to avoid other renal drugs that have renal effects or something like that.